Welcome back to Zaco. If you've been following us, you know that we've been on a journey to discover the most prevalent healthcare-associated infections as part of our free mini-course. Today, we will conclude this mini-course with a fifth and final video covering a major topic in infection control, a topic that is earth-shattering. In the war against infectious diseases, antibiotics have long been our strongest weapon. But what happens when the enemy no longer responds? Multi-drug-resistant organisms, MDROs, are bacteria that have evolved to outsmart the drugs designed to kill them. They spread silently, thrive in our hospitals, and turn routine infections into deadly battles. This is not science fiction. This is now, and the threat is growing. It's time to understand. It's time to act. Multi-drug-resistant organisms, or MDROs, are bacteria that have developed resistance to multiple antibiotics, drugs that were once effective in treating them. Some of the most common MDROs include MRSA, methicillin-resistant Staphylococcus aureus, VRE, vancomycin-resistant Enterococci, CRE, carbapenem-resistant Enterobacterales, MDR Acinetobacter, and MDR Pseudomonas aeruginosa. These organisms are not just harder to treat, they're often linked to increased morbidity, mortality, and healthcare costs. Let's break it down further. Normally, antibiotics kill bacteria or stop their growth. But when bacteria are exposed repeatedly, especially when antibiotics are misused or overprescribed, they can evolve defenses that allow them to survive. Think of it as bacteria wearing armor. And once that armor is built, it can be passed on to future generations, or even shared with other bacteria. The danger of MDROs lies in three main areas. 1. Limited treatment options. These organisms are resistant to many, sometimes all, standard antibiotics, making infections difficult or even impossible to treat. Furthermore, the discovery path of new antibiotics has been somewhat uneventful in the last few years. The rate of evolution of bacteria is quite alarming and is much faster than the rate of new antibiotic discovery. 2. High transmission risk in healthcare settings. Hospitals and long-term care facilities are high-risk environments, especially for vulnerable populations like the elderly, immunocompromised, or post-operative patients. The route of transmission for these MDROs are frighteningly simple. A nurse forgetting to wear gloves or wash her hands opens the door just enough to allow the MDRO to infect another unwilling host. 3. Poor outcomes for patients. MDRO infections are linked to longer hospital stays, increased complications, and higher mortality rates. Preventing MDROs is critical to maintaining high standards of care and patient trust. MDROs spread primarily through direct or indirect contact. This includes contaminated hands of healthcare workers, shared medical equipment, surfaces such as bed rails, call buttons, or door handles. It only takes one moment of missed hand hygiene or improper PPE use to contribute to an outbreak. Let's talk about prevention. Fortunately, we have proven methods for reducing the risk of MDRO transmission. These include hand hygiene. This is the single most important action we can take. Perform hand hygiene before and after contact with a patient or their environment. Use alcohol-based hand rubs or soap and water, especially when hands are visibly soiled or when dealing with C. difficile. Remember, clean hands save lives. For more information, watch one of our previous videos on the basics of infection control practices. PPEs, proper use of gloves, gowns, masks, and eye protection protects both patients and staff. Don PPE before entering the room of a patient on contact precautions. Remove and discard PPE before leaving the room. Always perform hand hygiene after PPE removal. Training and audits help ensure compliance. Contact precautions and isolation. Patients colonized or infected with MDROs should be placed on contact precautions. Private room or cohorting with others with the same organism. Dedicated or disposable equipment. strict signage, and visitor guidance. MDROs can survive on surfaces for days, sometimes weeks. Use EPA-registered disinfectants effective against MDROs. Focus on high-touch areas. Ensure cleaning staff receive regular training. Use checklists or UV audits to verify cleaning effectiveness. Antibiotics should be used only when necessary and always at the right dose, duration, and spectrum. Your facility's antimicrobial stewardship team plays a vital role in reducing unnecessary antibiotic exposure and, in turn, resistance. Don't pressure prescribers for antibiotics just in case. Support culture-guided treatment plans. Early identification helps contain the spread. Some high-risk units may conduct active surveillance cultures. Labs should notify clinicians and infection prevention teams immediately when MDROs are detected. Data gathered helps track trends and focus interventions. Education is the foundation of compliance. Train staff regularly on MDRO risks and precautions. Teach patients and families about hand hygiene and infection control expectations. Use visual reminders, checklists, and brief huddles to keep protocols top of mind. Let's put this into perspective. Infection with an MDRO isn't just a clinical concern. It's a quality of care and patient safety issue. These infections can lead to delayed recovery, rehospitalization, emotional and financial strain on families, institutional reputation damage, regulatory and accreditation penalties. Preventing MDROs is not just the job of the infection prevention team. Every person in the healthcare setting plays a role. Nurses, physicians, housekeeping, dietary services, administration. One breakdown in the chain can lead to transmission. When we work together, we protect patients. We protect our coworkers. We protect ourselves. Thank you for your time and commitment to patient safety. Let's stay vigilant, informed, and proactive, because in the fight against MDROs, every action matters. And that concludes our 5-part mini-course on HAIs. If you haven't watched the first 4 videos, click above to watch the first video in the series. Subscribe to our channel. We sincerely hope you enjoyed this video. Please feel free to leave any suggestions, requests, or questions in the comments section, or send us a message. To learn more about Zaco, visit our website, www.zaco-sa.com, or email us at admin@zaco-sa.com. WhatsApp or call us at +966 565 405 419 to reach our experts for assistance in accreditation matters, such as Sabahi, JCI, or Gahar. Follow us on social media, where we post tips, tricks, and motivation for you on a regular basis. Don't forget to subscribe to our channel to be notified of our videos when we post them. Zaco, the power of expert consultations in the palm of your hands.